Hello again everyone, Dr. Dan Bockmann here. Today we're going to talk about my foam rolling guidelines for my patients. So this is a firm density foam roller. You'll find many different kinds of them. I like the firm one for a reason I'll tell you in a minute. But first we're going to go over the mechanics of this just to get that down, and then we'll talk about guidelines, how often to use it, what to look for. So basically the two most common areas that I use this for are IT bands, which runs down the outside of the hip and thigh, and quad. You can use them on calves, you can use them on glutes and hips too, but these are the two most common areas I prescribe for. So to roll IT band, which runs from ilium to tibia, hence the IT, you'll start on your side on the roller with your down leg straight, and you can cross this top foot over, and then you're going to walk your way all the way to the knee, almost to the knee joint, but not quite there, and then all the way back, and you can use this foot to balance as you roll. Now I'll say always start with 3 full-length passes, and they are your test to see if you need this or not. And what you're looking for is, does it hurt to roll any of this area? And if there are any painful spots in there, you will find them in 3 passes. And once you've mapped out where those painful spots are, if you find some, then you will spend 3 minutes rolling those spots. It may be the whole section, it may be just the top, it may be different from side to side, left or right. None of that matters as long as you find the painful spots. Spend 2 minutes rolling those painful spots. Do that every 3 days, not daily, but every 3 days, and until those spots are no longer painful to roll over. So this can be excruciating, but as I've said in a previous video, it is not normal for foam rolling to be super painful. Now I'll add a qualifier to that. Now this is a body weight based massage. This is the tool you're applying that massage with. The larger you are, the heavier you are, the deeper a massage you're getting. So as I said, I prefer a firm foam density roller. But if you're larger, or if these are just too painful to roll over, you can use a softer form or a version of a foam roller just to get you get this inflammation and scar tissue broken down enough to where you could graduate to this one, which is just a deeper and better massage. So 2 minutes per IT band every 3 days until it no longer hurts to roll those areas. Then touch up for life. So this is not a one and done thing. Even though you may break up any scar tissue that's gluing things together and they feel great to roll over, a year from now stuff may have accumulated again. So the foam roller is the test to see if you need the foam roller. So every so often I'll just do a few passes, 3 passes, and if I don't find anything painful, don't need it. If I do, I roll those areas every 3 days until they're not painful anymore. So basically the foam roller is the test to see if you have a problem, and it's the fix for that problem if you have it. So I hope that seemed helpful. If so, great. Leave us a like and a share, and if you have a question you'd like me to answer, leave it as a comment, and look for more of these home rehab video clips coming in the future. Until next time, I will see you guys there.